My advice to anyone who wants to be a clinical scientist is to go for what you want to do. Go for the projects that you want to work on. Go for the end result that you desire for your career. After graduating, I started working as a research assistant and I did some molecular biology work, but I really wanted to work in a diagnostic setting. So I started looking at different careers that would help me get into a diagnostic setting where I could use all my molecular biology skills, and that's when I came across clinical scientist training. So from then on, I went on to do an MSc that would help me bridge the gap between my molecular biology background and infectious diseases, because I was interested in infectious diseases and I wanted to become a clinical scientist in that area. So the scientist training program is actually a graduate program. So most people can apply and be accepted onto the program from their undergraduate degree. However, there's also an in-service application process where if you're already working in an NHS diagnostic laboratory or any other diagnostic laboratory that is affiliated, you can apply to become a clinical scientist. My typical working day starts with a little bit of office work, which is just desk work, going through my emails, going through anything outstanding that I need to finish off, square out, and then I will then do any meetings that I need to do in the morning, and the rest of the day, usually in the afternoon, is when I do all the lab work. However, this is often interspaced with any training or any site visits if I am doing any verifications with any of the other labs. The skill I think you most need to be able to be a good clinical scientist is actually people skills. Being a clinical scientist is a very dynamic role, and you're often doing 3 different things, 4 maybe in one day. And that usually requires you to be able to communicate effectively with people from different departments. For instance, when you're doing a verification for a new method, you want to be able to give that method to other people in another department, be confident enough to use it without you being there to help them. That requires a lot of really good communication skills. My advice to anyone who wants to be a clinical scientist is to go for what you want to do. Go for the projects that you want to work on. Go for the end result that you desire for your career. I really like that there's different challenges every day, and no 2 days are the same, no 2 weeks, 2 months are the same. I really enjoy the challenge of being able to think on my feet and then actually work through the challenge, and at the end of it, being able to deliver it to my colleagues and say, actually, this is how we approach this, and seeing that method, seeing that new technology being used in diagnostic laboratory. Being a clinical scientist is a very demanding role, so it's very important for you to be in a position where you enjoy what you're doing.